All right, it's preparing to live stream. All right. I think we're good. Okay, should I let people in? Are we ready?
Yeah, it's 5:01. You should let them in.
Okay, here we go.
Hello, everyone. Thank you for joining Milwaukee County Department of Health and Human Services this evening. This is the first of a three-part series of community conversations. Today, we'll be focused on basic needs. My name is Sumaya Clark, and I serve as the Enterprise Project Administrator. And I'd like to introduce you to our director, Shakita LeGrant McLean.
Thank you, Samaya. Thank you, everyone, for joining us today. We are so happy to have you and really looking forward to hearing inputs or questions regarding the needs of the community. Can you move it to the next slide? So I just wanted to provide just a brief overview about Department of Health and Human Services. So Department of Health and Human Services, we consist of a few divisions. So we have our Behavioral Health Division, we have Disability Services, our Housing Division, our Youth and Family Services Division, and since 2020, our 2021, we have Aging and our Veteran Services. And so the mission of Department of Health and Human Services is really to empower safe and healthy, meaningful lives. And our vision is, as we come together, we can create healthy communities. Our values, we call them our PRIDE values. And what that stands for is partnership, respect, integrity, diversity, and excellence. And as we look at our values and our mission and our vision, being very much in line with Milwaukee County's vision of becoming the healthiest county in Wisconsin through racial equity. So we wanted to show the alignment of Milwaukee County with Department of Health and Human Services. And so if we look at our county's three strategic focus areas, the first one is really about creating intentional inclusion. And that is one of the reasons why we're here today. It is important that we hear from the people that we serve, that we include you, that you have a voice at the table. And so it reflects the full diversity of the county at every level. It includes our community, it includes the people we serve, our stakeholders, our providers. And so it's really important that we are intentional and we really do nurture a culture of that across our county, internally and externally. And then the second one is really bridging the gap. So as we will talk about in later slides, really breaking down the silos across the county and really applying that racial equity lens to all of the decisions we make. So in order to become a healthy county, right, we have to address the disparities that are happening in our community. And one way of doing that is investing in equity. So looking at the upstream, so really investing in how we can meet the needs of the people we serve to address those root causes of those health disparities. And also looking at the fiscal health and to break down the barriers as we see in our community and across Milwaukee County. And so as we look at the bigger picture, the bigger picture for Milwaukee County, Department of Health and Human Services, we have two strategies. And one is really our no wrong door. And as we look at integrated services and breaking down silos and placing the person, whoever we're serving, at the center of what we do and wrapping those services around them. So really looking at those underlying needs of the people that we're serving and saying, how can we meet you where you are? What does that look like for you as an individual, whether that's a child, a youth, an older adult, a person with different abilities, and getting those services, those resources, those supports to make sure that they live their best and their healthiest life in the community. And that second strategy is really around population health and really looking at how do we change the system? How do we break down those silos? How do we make sure that the barriers that people have had for years, and that we can begin to change what that looks like for them. So there's a lot of work that's going into that with Department of Health and Human Services, really to help move this vision forward of becoming the healthiest county in Wisconsin. And so we talk about our commitments here in Department of Health and Human Services. We really talk about addressing what we call social determinants of health. But when we say that, it is the conditions of where people live. It's where they work, it's where they play, right? And how do we address those racial inequities and make sure that we are meeting people where they are and giving them what they need to be successful. And so part of that strategy is through our No Wrong Door. And No Wrong Door really does help us, as we talked about our vision of together creating a healthy community, it helps to improve those outcomes of Milwaukee County residents and really focus on how do we achieve what racial equity is so that we can become that healthiest county. And so when we think about No Wrong Door, is creating an easier access so that we can have quality care, we can be person-centered, and we go back to those three strategic focus areas. It really is, how do we be person-centered through intentional inclusion, right? Really getting hearing the voice of those that we serve and ensuring that we have improved customer experience. It's not just about, we can say, these are the services that we have, here you are, but instead of you telling us, what are those needs? What are the underlying needs that you need to live your best lives, and then meeting you where you are. And then when we talk about, again, that bridging the gap is giving people, really looking at the unique needs, again, of individuals, placing them at the center of what we do and tailoring those services. And so no matter what your age is, no matter what your race is, no matter what your gender, your age, your social economic, that we are going to serve you across the lifespan, that we are going to meet you where you are. So that's what we are committed to here at Department of Health and Human Services. I'm really proud of the work that the leadership team is doing, and really proud of us when we talk about all in and both feet in, being intentional to say, we want to hear from you and we want to make sure that we're meeting people where they are. So thank you all. And really just lastly, we talk about racial equity and what does that mean and what is the beliefs for DHHS, Department of Health and Human Services, again, really addressing those disparities in our community and valuing people individually, meeting people where they are and finding out what those underlying needs. And that's what today is all about, focusing on what those underlying needs are and being able to provide, whether that's services, whether those are programs to enroll you in, whether those are resources that we can get you connected. And not just in Department of Health and Human Services. Together does not just mean Milwaukee County. It means bring people together at the table that can do this work, because we cannot do it alone. And then making sure that we acknowledge and we rectify what those current policies and practices are that will inflict harm, right? Taking the trauma out of it and really being that safe place where you can say, I know I can call Department of Health and Human Services and they will meet me where I am. I can call Department of Health and Human Services and I know they will help me find the resources or the supports I need to live my best life. So that is our belief and that is our commitment to you. And as we talk about racial equity, I know Deputy David Muhammad will talk about our strategies and how we're going to get to our future state next.
Thank you, Director LeGrand.
Thank you.
And thank you to everybody who's viewing. The Department of Health and Human Services is committed to advancing what we are calling the No Wrong Door strategy through integrating services and care. And it really focuses on families as a way to coordinate care for individuals and their support systems. We are advancing strategies to orchestrate human care across the age continuum. We are looking at ways to eliminate bureaucracy so we can get to the answer yes and address needs rather than finding complications or ways to say no. And that is a guarantee for those whom we serve at every point that they enter the system. When we say no wrong door, that means if they present with a housing need, we can identify later on some care for a substance abuse need or a family member who might be a senior or a person with a disability. And we want to address root causes of those needs. We want to move services upstream and partner with agencies that address social determinants of health. You've heard that term several times in tonight's presentation. We're committed to that. When we talk about making Milwaukee the healthiest urban county and the healthiest county in the state, we're committed to addressing and moving the needle on those aspects that affect people's quality of life from birth all throughout their transitions. And we want to address racial equity within policies and practices, including within our contract network. When we say no wrong door, most people know our services through our contracted providers. So that community service agency or the place where you identify care for a loved one or for yourself, oftentimes is contracted with by Milwaukee County. We are not only a service provider in that regard, but we are also an economic engine. So we want to make sure that we are promoting diversity in the service fields and in the helping professions, and that we're developing talent to help bring about the next wave of support for our own staff inside of DHHS and make sure that we reflect the population that we serve. This takes us to strategy 2, which advocates for population health and systems change. As we talk about No Wrong Door and coordinating services within DHHS and with our contracted providers, we know that we can't move the needle on racial equity or on social determinants of health without partnering with philanthropy, without partnering with our academic providers, without working in close alignment with other governmental agencies and intergovernmental partners such as the cities and municipalities within Milwaukee County. So the focus is on collective health. We see the size of DHHS as the largest department inside of Milwaukee County with a significant budget and workforce as a entity that can really be a catalyst for systems change and be a convener in those efforts. So we see our role as a leader in that regard to address structural racism, and we are committed to that and committed to advancing change within our own institution to reflect that and influence the provider network that we work alongside. We are looking to redirect more of our services, as I've stated earlier, towards prevention. We're committed to moving those services upstream and those resources to help meet that need. We would like to influence funders in the allocation of resources and amplify and center community voice in these discussions. So tonight's event is actually a part of that and an invitation to community members to get to know us, to know the services that we provide, and also share input on the direction of the Department of Health and Human Services so that we can achieve that state that we all would like to live in, which is an improved Milwaukee County, the elimination of racial disparities, and to address the quality of life for all of the county's residents. Next slide. So we achieve this, and we talk about integration, and we want to make sure that we're clear on what we mean by this. It is care coordination across all of our partners and community health transformation. So when we talk about integrated services, and some of you might have heard with the inclusion of the Division on Aging and some of our veteran services that are offered through the Division on Veterans Affairs, that recent movement from parallel services to a vertically integrated model. So we're comprised of many divisions in the Department of Health and Human Services, but we know that need is not a linear type of need, that this is going across the lifespan of people's lives, and that it's multi-generational in many people's families. So while we're talking about improving services, some efficiencies might be identified and there might be nominal cost savings, but we're not identifying efficiencies at the expense of services. We are looking on how to better use the resources we have to meet those needs. So movement towards greater horizontal integration is our goal, with the aim at greater effectiveness and participant satisfaction, and the recognition of the complexity of service integration. We've mentioned several models that we've discussed with regards to housing or behavioral health or some of those other needs, and our administrators will speak to what they do and how we collaborate internally and with our community providers as well. So community health transformation is another way that we are advancing this strategy of No Wrong Door in our future state, to address inequities in health outcomes through primary prevention and systems change where people live, work, and play. This is critical for us. If we're not working to put resources upstream, then we are simply advancing the safety network that is vital, that is critical, but it will not stop and address those things before it gets to the critical stage where people find themselves in need of help. And so we are working feverishly to make this happen. We also are working towards healthier communities in which residents are engaged in their own well-being and the well-being of other residents. Community health partnerships that utilize Indigenous community health promoters, and social marketing that emphasizes positive health outcomes. Next slide. So our major service areas are in these categories right here, and we're going to hear from some of our administrators. I'll pass the floor back to Administrator Clark to help us move on in the program. But these are some of the areas, as you see, of services and support and programs that we offer with children and adults with disabilities. We have our Disability Resource Center, the Children's Long-Term Support Program, Birth to 3, the COP program, or Children's Community Options Program, and Adult Protective Services. Youth services, of course, we have the Detention Center, but as we move through youth justice into a more preventative space, we're moving into areas of community-based diversion and peer support, as well as community-based alternatives to incarceration, such as shelter and group care. And then our aging and adult services. Obviously, the aging division does a significant amount of work in this field with senior dining in the 27 congregate sites, transportation and wellness programs, and social programming through our senior centers, even through the pandemic, operating many of these services virtually. Legal benefits, family caregiving, community outreach, and the disability assistance program, the burial assistance and energy assistance programs. I turn it back over to you, Administrator Clark.
Thank you, Deputy Director. And so what I'd like to do at this time is allow the visitors with us today to hear from each of our administrators. And so we're going to start with the administrator of the Children and Adults with Disabilities Programs and Resources, Disability Services Division, and that is Administrator Marietta Luster.
Thank you, Administrator Clark. Marietta Luster, Disability Services Division. In Disability Services Division, we have a Disability Resource Center that works with individuals ages 18 through 59 for eligibility into programs such as IRIS and family care. So an individual coming to us will seek eligibility to be enrolled in those programs, and that's financial eligibility and functional eligibility. We also have our children's programs. We have our children's long-term support program, All In for Kids. That's where kids can get respite and childcare, transportation, supported employment, some daily living skills, home modifications, and adaptive aids. We also have our Birth to 3 program, which is an early intervention service program, where 25% delay in one or more areas of development. That includes behavior, social, emotional, cognitive, speech, language, or motor skills. We also have our Children's Options program, and that program is inclusive for community engagement. And we have youth services in that program as well. We also have our Adult Protective Services program, where we investigate abuse, neglect, and financial exploitation of individuals ages 18 and up, regardless of their age or ability. We are investigating if they have been abused, neglected, or financially exploited, or some self-neglect. We also have the Interim Disability Assistance Program, also known as the IDAP program, where that's before a person becomes eligible for SSI. We also have our Disability Benefits Specialist program, where individuals can come and see if they are eligible for disability benefits. And we have our Burial Assistance program, where individuals can come and seek the assistance that they need on the passing of a loved one. Thank you, Administrator Clark.
Thank you. Would you mind, before we move on to the next administrator, would you mind sharing some of the ways that we've worked to meet the needs of individuals in response to COVID who have disabilities?
So in meeting the needs of individuals that have COVID during this trying time, individuals, the abuse and the neglect did not stop. And so individuals who were abused, neglected, financially exploited, workers were able to go out and to assist those individuals. Sometimes they had to move them from their primary residence, and so they had to place them outside of the home. And so we were able to continue that nonstop, even during COVID, able to protect these individuals that are unable to protect themselves. We use our resources. We have a lot of partnerships with law enforcement and with the hospitals and other community partners. where they were able to go in and actually remove the person for us. And we are also, now we're doing home visits, and we can go out and remove those individuals ourselves to put them in a safe place where we can know that they are safe and their welfare is being taken care of.
Thank you for sharing that. And
Sure,
so the
you're
next,
welcome.
sorry about that. So the next administrator that we'll have is Interim Director John Janowski.
Good evening, everybody. Nice to be with you all. My name is John Janowski. I'm the Interim Director for the DHHS Division on Aging. And in a nutshell, our division is really the single point of access to services for people 60 and older in Milwaukee County. Every day we meet our mission by affirming the dignity and value of our older adults by supporting their choices for living in and giving to our community. And that takes many different forms. Ultimately, our vision is that we want all older adults in Milwaukee County to have all of the resources they need to live as independently as possible in their communities. We essentially have two basic units as part of the Division on Aging. We have an area agency on aging, which essentially coordinates services with many of the vendors that Director Mohammed, Deputy Director Mohammed spoke about. We have a very extensive network of vendors, partners, collaborators that help us coordinate and provide those services. And then the other side of our business line is the Aging Resource Center, which is the bulk of our staff. And the Aging Resource Center is essentially the single point of contact that we refer people in the community to get accurate, objective information for all kinds of resources that people need to live independently. And that takes the form of a lot of different resources and outreach materials, including information and assistance call centers, and many other resources that we are directing people to every day. But the whole point of the Aging Resource Center is that they provide objective, unbiased information to people who contact them on a daily basis. And I would add that our services are both in the Aging Resource Center and in the Area Agency on Aging are detailed on our website. So I'm not really going to go too much further into all the different services that we provide and coordinate. What I would spend a little bit of time on is just to acknowledge all of the amazing efforts that our staff have made to transition services during the pandemic. It's really remarkable when you think about how we had to transition, for example, from a congregate dining model literally overnight to a model where meals are picked up and carried out at different congregate sites throughout the community. We didn't miss a single day of service in terms of our congregate dining program. We had to deliver meals with our transportation provider, which is certainly something we never envisioned doing. And we literally tripled the number of meals that we provided to the community last year through that process. We had to change our transportation services in the sense that we couldn't provide group rides anymore, but we still provided individual rides so people could get to their medical appointments and to the grocery store. We also added rides to the polls. We worked with other partners in VHD to prop up a service so that individuals who are COVID positive could get a ride to their medical appointments. That was a significant value add. We had to change the way our home visits were done in the Aging Resource Center. Couldn't go into people's homes anymore. So a lot of those communications had to be done over the phone and electronically. And just the lift in terms of transitioning to a telework environment was a huge achievement in the Aging Resource Center. We had to shut down the senior centers and provide more virtual programming and outdoor programming. We made literally through our vendor network, over 10,000 phone calls to seniors to check on their well-being and ensure that their needs were being met. those phone calls, continue to this day. That's 13 months of phone calls over that period of time. We've helped a lot of people, and I would just conclude by saying we've worked with many different partners in the county to do a lot of outreach to our isolated and homebound seniors to get them connected to vaccine. We've provided thousands of phone calls to seniors to register them for vaccines at the county's vaccination site. We've provided rides to seniors to get them to that site. So I'm just really proud of our COVID response, and there's a lot more that's there, but we couldn't have done it without all of our partners in DHHS, as well as our partners in the community. So I want to thank all of them for their help.
Thank you. Before you go, would you mind sharing just a quick update on the upcoming sessions that you have so that we can get more feedback from older adults?
Sure. Thanks, Amaya. This year is a huge year for us because it is our biggest planning year. Every year, or every 3 years, I should say, we coordinate an area plan process, which is essentially the development of a 3-year strategic plan for aging services in the community. And it's by far our largest and most significant project that we take on. And so we are in the middle of that process right now. Next week, we will be releasing a community needs survey that will be online on our website. We'll also have paper surveys available for people that don't have access to that technology. And the whole purpose of the survey is this is a customer-driven process. We want to hear from older adults and their caregivers what their needs are, what they want to see us improve on, what services we might be able to enhance or expand, or what aren't we doing that we should be doing. And that whole process, the survey process, will run from next week through about the middle of May. And then we're going to also be holding several input sessions, public input sessions, to also collect feedback. Again, these are going to have to be virtual this year. And we're going to take all this information that we collect and put a new 3-year plan together. And that plan needs to be approved by the Milwaukee County Commission on Aging and its advisory council, as well as the county executive, the county board, and the state of Wisconsin. So it's a huge process, and we really encourage you to take our survey and tell us how we can better serve you. So thank you for mentioning that.
Sure. Thank you for sharing those exciting updates, and also acknowledging all of the staff and community partners who've really worked to make sure that we were being responsive to the needs of our older adults. Next, I'd like to switch to youth services. And so we'll be hearing from Administrator Mark Mertens.
Good evening, everybody. There we go. Good evening, everyone. I can tell you a little bit about what's happening in youth services and just to illustrate a little bit how we are working to attain the values and the goals that were described by Director LeGrant and Deputy Director Mohammed. First of all, we're working very hard toward racial equity. One way that we're doing so is through our efforts to bring our youth home from Lincoln Hills and Copper Lake schools and serve our youth locally, where they can receive more culturally relevant and appropriate services delivered in a more safe and caring and trauma-informed manner. And we can assure that youth that need to be in a secure setting for a time in order to get the services that they need are actually getting effective services, that they're learning the skills that they need to learn, that they're receiving the treatment that they need to receive. And we're establishing a whole continuum of services for those youth so that when it's time for them to leave a secure setting, they can safely transition into the community with lots of supports. We've established a credible messenger program, which you'll be hearing more about in the near future. We're going to have a kickoff in May of the program. And basically what Credible Messengers does is it pairs youth, justice-involved youth with adults with lived experiences, generally with the justice system. So people that have been involved in the justice system themselves, for example, and are in a place where they've made changes to their lives, and where they can serve as a very relevant and useful mentor to youth that are currently in the system. We're really proud of this program. We think it's got tremendous potential here in Milwaukee. We've done a lot of research on it. We've looked at similar programs in Washington, D.C. and New York City, and California, Oakland in particular. Deputy Director Mohammed has been very involved with us on this program. We're very appreciative of his leadership in this program. We're also looking, so as we reduce the number of youth that are at Lincoln Hills and Copper Lake, you might imagine that it's fairly expensive to serve youth in an institution like that. And in fact, by July of this year, it will cost us about $800 per day for every youth sent to Lincoln Hills. Imagine what we can do in the community for that amount of money. And we intend to do just that for every youth that returns to the community, and the savings that we incur from that, we're reinvesting that into community-based programming. That means more jobs for youth this summer. We're working with partners in the community around jobs programming for youth. It means more services like Credible Messengers and other services, expressive arts types of programming, and other things to provide positive pro-social outlets for youth where they can attain the skills that they need to really begin to identify with a positive future in our community. We're in the process of implementing a brand new case management model that's getting some national attention, but has started here in Milwaukee. It's called the Growth Focused Case Management Model. And it's really all about that. It's about helping youth find their purpose in life. And it's about helping them get the skills that they need to not just prevent them from recidivating, committing new crimes, but to actually grow into a lifestyle of desisting from crime. So moving on to a pro-social lifestyle. We're very proud of that. I have a question about the outcomes for the youth that are participating in the program. Well, the program is brand new. I think, I don't know if the person is asking about Credible Messengers or Growth Focused Case Management. Both are new programs, so we will be tracking outcomes and reporting back on those. When we talk about the future state of the Division of Youth and Family Services, I think what you will see from us is a much more authentic place in the community, where we're working closely with the community, where we're establishing learning communities, peer learning communities. We're learning side by side with agencies in the community and with community members about specific problems and searching together for solutions. And in the future, we're looking to have the community more involved in setting priorities for our division around how that reinvestment gets spent. So what you're going to see in the future is a much broader dialogue around how we find solutions, because there are solutions within our community, and we're very confident that if we take the time that we can find those solutions. So we're really pleased to be working so closely with people in the community. various agencies and very passionate community members and advocates. So very proud to be a part of that. Let's see. Lastly, I would say, we're also working to develop a process whereby, I know what I wanted to say. Look for sometime around May, we're going to begin community forums where we're going to be talking about what it takes for a community to end incarceration, for us to get to zero youth at Lincoln Hills. We've made great progress. We've reduced the number of youth there by about 70% in the last 5 years, but we think we can get to zero in 2021. And we'll be reaching out to the community to ask about your priorities, about what that takes. We'll be introducing to you our new project manager, our Zero Youth Corrections project manager, a person by the name of Eric Weaver, who's worked closely with many agencies in the community, and he'll be leading our efforts along that way. So the first community forum will be about introducing Eric and talking about some of our strategies to reduce incarceration, and then asking you what your priorities are so that we can incorporate those priorities into our strategies moving forward. So there's a lot happening in youth services. I think we're really on the cusp of some real transformative work within the division where we can help reset the trajectory for many of our youth, and where we can really change the face of youth justice to be one that is more about support, skill building, and helping youth find a purpose and a place within their own community. So thank you very much.
Thank you for that. And just to also highlight some of the things that you spoke about, Mark, that are related to the questions that we're getting. There are a few questions about outcomes and supports that are provided, and when will this begin? Well, we have been working on youth justice reform for several years, and we have a variety of outcomes depending on the level of service that we're speaking about. So we have outcomes specific to young people, specific to families, specific to working more collectively with various community partners. So as Administrator Mertens spoke about, there's some forums that'll be taking place in May, and we will be highlighting those specific strategies and talking about our whole system of care. And at that time, we'll be able to talk about some of the metrics that are related to each of those. So please join us for those sessions that'll take place in May. And Deputy Director Mohammed did list some of those metrics as well. So, I gotta thank you. So, thank you. Please keep those questions coming. As you can tell, we are definitely committed to making sure that our young people are safe and they're able to thrive. And also that we're transparent and inclusive in our process. We want to hear from you. And then the last thing that I just really want to highlight that Administrator Mertens talked about is the 75% reduction that we've seen. And can you just highlight, we were well over 100 young people on average, and now we're down to what number?
We're right around 20 today.
Yeah, so that's significant. So we'll continue to have these partnerships to be able to better support young people, because we don't want to spend $800 a day for young people, and we'd much rather reinvest that money into healthy options that support families and the communities in which they live. So thank you so much, Administrator Mertens.
Thank you.
Okay, so now we are going to move right into the Behavioral Health Division. And so we'll hear from, let's see, I'm trying to see who's here. We'll hear from, is Mike? I'm not able to see him. So we have a few administrators here. We have Mike Lapham and Brian McBride, who will be able to share information on behavioral health services that are available to community members.
So thanks, Samaya. Hi, everyone. My name is Mike Lappin. I'm the administrator for the Behavioral Health Division in Milwaukee County. It's great to be here, and I could talk all day about the Behavioral Health Division, but I won't. I will just provide an update on current things that are really exciting for us. In general, the Behavioral Health Division provides mental health and substance use disorder services to the Milwaukee community. We focus a lot of services on crisis and trying to be there for people when they need us and make connections to quality services. We deliver many of our services through a series of programs that are delivered through community partner organizations, but we also operate our own inpatient psychiatric hospital. We operate a psychiatric emergency room called PCS, and we have a pretty significant crisis system that's out there in the community, both clinicians and non-police mobiles, and also a group of people that work in collaboration with law enforcement to co-respond to emergencies, to try to make sure that the people responding to mental health emergencies and substance use disorder related emergencies are actually informed about the best way to help people in crisis. Lately, our great initiative and what we've been really trying to do is to take the feedback we've gotten over the last few years from our community, which was to get our services away from 9400 Watertown Plank Road out there where nobody lives, and get our services closer to the people that need them, and the services make them much more accessible and reduce barriers to care. We've achieved this. Our first phase of achieving this is a series of community health center partnerships. So these are the federally qualified health centers that are long-standing great resources in our community. And what we've done is we've embedded some of our mental health crisis services and our access clinic services that used to be housed out at the county grounds. And now they are working together with our community health center partners to help them serve people in a mental health crisis. And so we have 4 partnerships at various stages of rollout. One has been going for about a year at Progressive Community Health Center on 30. One current
Administrator Clark, it looks like he fell off. Do we want to move?
And we do everything we can.
You might have to send him a message. So what we'll do in the meantime, we do have Brian McBride with us. And if you would be able to share information about children's mental health.
Certainly, I don't want to speak over Administrator Lappin, but I will certainly jump in until we can reestablish his connection. So welcome, Brian McBride, the Director of Children's Community Mental Health and Wraparound Milwaukee Programming. So just building off of some of the stuff that Mike said, I think what's really important is how we have built partnerships throughout the Department of Health and Human Services and across our community to provide unique opportunities and supports for youth that are needing some additional support, some additional opportunities for to be able to stabilize, to be able to have better outcomes. We certainly partner with child welfare agencies, Department of Child Welfare, along with Administrator Mark Mertens's area to be able to provide support for DYFS staff, as well as those that are being served there. What's really important for me to kind of drive home from a children's perspective is not only do we serve and work with youth throughout those many areas, we also have the privilege of working with their families to be able to provide support, to be able to provide opportunities for all those members of the family. And while we are focused the majority of the time on mental health services and supports, we're much more than that. We're able to provide different types of recreational activities, different types of places within the community for youth and families to be able to get information, really a public facing locations like Owen's Place, which is our drop-in resource center available to anyone that is looking for support and service. We are really focused, as you can see with one of these pictures, one of the things that we've done throughout the COVID pandemic was host these grab and go events at our drop-in resource center, and really was providing necessary PPE for individuals who needed it. And we do it through a drive-through type of style, right down to being able to provide other hygiene products, to be able to provide food and things of that nature throughout the last year. Really happy to be able to see that continue. And we've just started those back up again last month and are looking to continue those moving forward. But those are some of the things outside of formal services. As the title says, it's a part of Wraparound Milwaukee. That is one program we have, but we also offer comprehensive community service, our REACH program. Within our system of care, we also include our wellness clinic, which is psychiatric medication for youth that are enrolled in our programming. We are able to provide crisis mobile services throughout the community with our children's mobile team. So, we have those formal services and supports that's really built off of what Administrator Lappin was talking about, and how we're trying to be more community focused, and how we're trying to be able to have individuals access more support and services from the community, and not coming to our 9455 Watertown Plank address. So I'm really excited about the things that we have on tap in our opportunities that we've been able to secure from a federal standpoint, with numerous SAMHSA grants that are looking to expand our services and bring new ways to be able to serve our community. So we have multiple grants that are around system of care enhancement, around crisis expansion, working in partnership with BHD to be able to look at some of those changes around PCS and the community health centers that we are currently moving forward on. So just a little snapshot of what we're doing. Certainly want to turn it back over to Mr. Lappin if he is currently back with us.
Yeah, so I tried a different connection, so I apologize so much for breaking up.
There you go.
Would figure that right when I'm live, then my connection breaks up. So I think I was, before I froze up, the community health center partnerships, essentially the idea is to provide services closer to folks' homes and make it easier to get to. So we have a clinic at 16th Street Community Health Center, our Access Clinic South. We have a clinic at Outreach Community Health Center at our Access Clinic North. Progressive Community Health Center has a team called Team Connect that works with people who've had a recent hospitalization or emergency room visit, and to make sure that they're connected to the services they need. And we're working really closely with Dr. Izzard at Milwaukee Health Services on 82nd and Silver Spring at the COG Center. So we will eventually have another partnership there. This will give people an opportunity to get services in 4 key neighborhoods in the community. And then the exciting news that you've probably seen it in the paper is that the BHD and the health systems have come to an agreement to operate a joint venture crisis emergency center called a Mental Health Emergency Center on 12th and Walnut. Zoning actually went through last week, so we reached another milestone. But that Mental Health Emergency Center will provide walk-in services for people in a mental health crisis, and it will also provide a very quick change or transfer of custody for people who do require intervention of police in a mental health emergency. the new location is much closer to the neighborhoods we serve. About 93% of the people who get admitted through our psychiatric crisis service today are City of Milwaukee residents, and about 80% of the people we serve come from 10 zip codes. 8 of them are on the north side, or 2 on the south side, all of which about 5 minutes from the new center's location. So we really got to this point based on a lot of community feedback that said the biggest complaint about our services was how hard it was to get out to our location. So again, we do everything we can to reduce barriers, to make our services more available. The COVID-19 pandemic has taught us that where people don't have access to quality healthcare, they're disproportionately impacted and have worse health outcomes. Mental health and substance use disorders are just other health conditions, just another health situation. So it was, when you look at the data and you look at the impact on the community, those neighborhoods that were most impacted by COVID-19 are the same places that don't have adequate access to mental health and substance use care. And thus we see those disproportionate outcomes, that disproportionate reliance on emergency rooms. So our goal is that if you have to come to our emergency room in a mental health crisis, that's the last time you have to come there, because we're going to connect you with great care in your neighborhood and great care that's going to help you achieve your recovery goals and really help you build a person-centered plan that meets your needs. And that's the overriding goal of all of our services. I'd be happy to talk about everything, but it would take all day. And I guess I want to make sure I'm available to questions or anything specific. We also are going to be doing a lot of community outreach with our new programs and services. So watch for those.
Thank you so much, Administrator Lappin, and also Director McBride. And so as we talk about the community outreach that we have, it's a perfect transition to Administrator James Matthey, who will be talking to us about housing services.
Thank you very much, Samaya. Good evening, everybody. So I'm going to talk briefly about the main program areas in the housing division, and I'll watch the chat if there's any questions. Starting off with one of our federal programs, our community development block grant funds and our home funds. So each community across the country, based on population and by formula, receives federal dollars that are somewhat flexible to serve low to moderate income citizens. So our CDBG program, we receive approximately $1.6 million annually to serve our CDBG jurisdiction. That does get a little complicated. The city of Milwaukee is their own jurisdiction, as well as the cities of West Allis and Wauwatosa. So our CDBG program serves all these suburban municipalities with the exception of Wauwatosa and West Allis. We split those funds between projects that are brought to us by common councils and by the mayors of our suburban municipalities, and the other half goes to nonprofits. The nonprofit set aside is competitive. We have an independent review panel that makes suggestions based on that funding. And then the home funding is used generally towards the development of affordable housing. So we use that to finance, do gap financing for large multifamily affordable housing developments. One of the significant funding sources for our home repair program is both CDBG and home. So we have an emergency home repair program for low-income homeowners that have emergency home repairs that they need on their homes. That could be plumbing, heating, roofs, those types of things. They can even call on short notice to access those funds. We work with the homeowners to find the contractors and do 0% interest loans on those programs. We also offer grants. So they're grants, not loans, to do any lead removal work that goes along with those jobs. So that's generally our CDBG and home area. Our division also, we have under our purview, Milwaukee County's Housing Authority. So those of you on the call are probably familiar with HACM, which is the city of Milwaukee's housing authority. We have our own at Milwaukee County. The difference is we do not own and operate public housing like the city does. We simply operate the Housing Choice Voucher Program. So we serve about 2,000 households in our Housing Authority program, Section 8. Almost 20% of our vouchers are what are called project-based vouchers. We've really focused in the past 10 years or so on the development of supportive housing. So we have taken our housing authority vouchers and attached them to newly constructed developments, typically those with behavioral health issues and substance abuse issues, clients of the behavioral health division and those that are homeless. So that's been a focus of ours with those vouchers. And again, 80% of those are Section 8 vouchers where households receive a rental voucher certificate and they can shop for a unit anywhere in Milwaukee County that meets certain rental guidelines, and we inspect every one of those units. So it's definitely our largest program area in the housing division. Our biggest area of growth in the past few years have been in our homeless services area. So we operate a federal rent assistance program separate from our housing authority called our My Home program. We serve about 550 previously homeless individuals that receive permanent housing vouchers through My Home, but we also attach case management and social services to those households. So that's generally scattered site rental assistance, where again, previously homeless individuals that were coming off the streets or from shelters can get one of these vouchers and again, choose to live in any community that they would like to. I mentioned the development of supportive housing, so we're very active in that space. So we have helped developers on the capital side and the planning of land development acquisition for those developments using low-income housing tax credits. We also design and support the services and the case management services that go into those buildings. So a majority of the supportive housing buildings in the county are supported with county tax levy funds for services. So we've done about 12 of those buildings. We work with various nonprofits to staff those buildings on site with case management as well as on-site peer support. And we support that with our division. One of the things we're probably most proud of in this arena in housing has been our efforts around our Housing First initiative. So we really started focusing on the Housing First philosophy around 2015, which is the idea that we would like our community to offer individuals living on the street without any precondition permanent housing and be able to serve individuals as quickly as we can, and then wrap voluntary services around them after they're in housing. So we've been very proud of that model. We do direct street outreach as well as permanent housing. So what we try to do is build trusting relationships with individuals on the street, and oftentimes the individual who you see helping you in street outreach is that same person that's helping you get your housing voucher, helping you find a landlord, and then connecting you to permanent services. So we're very proud of our work in that area. We've seen a significant reduction in homelessness since 2015, really with that philosophy. And again, the important thing about Housing First is that services are voluntary and our clients really determine their own care. That could be for some of our individuals, it might be as simple as bus tickets and employment programs. And if that's the extent of what your services, what you would like them to be, that is good enough for us. Some individuals would like more intensive mental health treatment and connections to our behavioral health division. And if that's the case, then we provide that as well. So very flexible services and definitely meeting individuals where they're at.
Thank you so much for that. And so, as you can see, there are a lot of things that we do with housing, and I don't know that everyone is familiar with all of the, like I should say, the breadth of services that are operated under Administrator Matthey's division. And so we are about 30 minutes until the conclusion of the event. And so what we'll be doing is we have two more presentations, one from Director Rick Flowers, who operates Veteran Services, and then also one from TJ Cobb, who will be telling us about Community Resilience Response Team. And so we'll hear both of those between 2 and 5 minutes. And then by 6:10, we'd like to shift to questions. I've been noticing a lot of activity in the chat box. Keep the questions coming. If there's anything that we did not get to in the chat box so far, then we will be spending the last 20 minutes making sure that we're able to have open dialogue and answer some of those questions. So again, two more presentations, and then we'll be opening the floor for everyone to ask more questions. And so Director Rick Flowers.
All right, thank you, Samaya, and I will keep it brief. So I'll just give you a brief overview of what we do here at Veteran Services. Again, I'm Rick Flowers, Director of Veteran Services for Milwaukee County. Veteran Services provides a host of benefit, assists veterans with obtaining a host of benefits, both federal, state, and some county benefits. The main thing we do is connect the veterans with those benefits that they may be eligible for. And we also work with veterans' families. One of the particular benefits that we assist veterans with is obtaining disability compensation. A lot of veterans who have served, who have suffered various forms of injuries or illnesses or ailments, or they may have entered service with some that were exacerbated by their service, are eligible to apply for disability compensation. And that's really helpful for veterans. And it also connects them to services in the healthcare field, be it mental health or full healthcare services at the VA hospital. So we work very diligently to connect veterans with those benefits. Another benefit that we really work hard to connect veterans with, these are our senior veterans who are eligible for pension benefits, which carries with it some assistance with veterans who are in need of homebound care or who are in need in aid and attendance or standing in a nursing care type of facility. These are very important for veterans and their families when the veteran, gets to that point where they may be in need of those services. Those services are also available to surviving spouses of veterans. So if a veteran passes away and they were eligible for, pension benefits or disability, their surviving spouses can also apply for those benefits. Again, our biggest thing is connecting veterans with a host of benefits that are available. Wisconsin is one of the most veteran-friendly states in the union. We rank in the top 3 in terms of the number of benefits that are offered to veterans. And so it's our job here at the County Service Office to keep veterans connected to those benefits, to make them aware of those benefits, and to just keep them engaged. And so we're working diligently to do that. We have partnered with a lot of local organizations to fulfill those needs. Where we can't provide the service directly, there are a host of other veteran services within the community that assist veterans. Veterans are well taken care of here in Wisconsin, particularly in Milwaukee County, and we work collaboratively with a lot of people to make that happen. And so with that, I'll pass it on to the next person. Thank you.
Thanks so much, Director Flowers. And so the last presentation that we have will really be focused on the Milwaukee Community Resilience Response Team. And this will be facilitated by TJ Cobb. TJ?
Good evening, everyone. My name is TJ Cobb, and I am the Enterprise Project Manager with the Department's Director's Office. And as Samaya said, I'm here to give a little bit of insight on the Community Resilience Response Team, also known as the Community Resilience Initiative. And this is a collective effort, including community-based organizations, faith-based partners, health clinics, municipal public health partners, as well as other health advocates. And so this group is ultimately aimed at ensuring that Milwaukee County communities have the ability to thrive and respond and heal in the state of a crisis. Ultimately, the mission is to eliminate racial and social inequities through social cohesion in the face of oppression, to drive systems change by eliminating protective factors across all social determinants of. Next slide, please. Thank you. And I also just want to really elevate how important the Department of Health and Human Services has been in serving as an anchoring institution to ensure the development and sustainability of the Community Resilience Initiative's mission and vision. And this group has been prioritizing convening community and grassroots leaders. It's led by a representation of credible advocates and community leaders who have the intimate knowledge of Milwaukee's history, including its impact on the pandemic that's happening today. This collective is equipped to offer community-based guidance, expand the reach of larger system strategies into high-need risk communities, as well as implementing grassroots efforts. Current initiatives are focused on COVID-19 crisis, as one of the principles of this group is to be flexible to the community's needs. And we know that COVID is at the forefront of where we are right now. And so a lot of our efforts have been focusing on ensuring communication strategies are community-centered and providing a timely, accurate, and credible health information via various outreach efforts through community organizations as well as small businesses. We've also been prioritizing efforts to ensure resources are equitably deployed to grassroots organizations and also meets the immediate needs of those individuals and families that are being served, and engaging grassroots organizations, community-based organizations, so that they can receive training to facilitate community empowerment. We know that a lot of our community-based organizations and grassroots efforts have the direct relationship with the vulnerable groups and individuals that we're looking to serve. And so we really want to elevate this platform for those organizations and individuals because they have the most reach and those connections with those individuals. Other efforts are centered around community defining and naming policy interventions that are necessary to health equity and economic mobility, and ultimately giving the means for the community to make those policies and interventions into law, and also working to ensure resources for the sustainability of community resilience efforts are sustainable, and cultivating leadership and organization around this effort. And so a lot of what this group stemmed from was really understanding that in order for us to create systems change to eliminate racial and social inequities, a lot of that work has to be driven from the grassroots and from those who are directly working in the community boots on the ground efforts, and ensure that they are embedded into the systems that we are looking to shift so that we are able to achieve racial equity and social equity as well. So I definitely want to thank the department and the leadership here for supporting this work. And I know that there's a lot of momentum and a lot of gratitude for those who have been in the community, who have been collaborating with this work. And it's definitely a means for us to achieve things that we know are very overdue, and using COVID as an opportunity to leverage some of the resources and leverage some of the resources that are being put into that space to achieve a lot of the disparities that we know exist across all social determinants of health. So
thank you so much for the presentation and for your work to lead this effort. And
yes,
so go ahead, you faded out for a second.
No, I was going to say, I apologize for the puppy noise, but thank you again.
We're working from home, so I think that's just one sign of how we've had to become more flexible over the last year. And so I'd like to have two administrators share two updates that are really important. The first is, let's see here. The first is going to be, so we have two individuals, Cleopatra Eccles. If you wouldn't mind sharing like just briefly about a minute to talk about energy assistance, because there are some important deadlines that are coming up about that. And then we also have Marietta Luster. Oh, so I just see that Cleopatra did post in the chat. If you could talk about the community cafe that's coming up. So about 30 seconds to a minute each.
I can add one more thing, Samaya, just that the utility, this is Cleopatra, sorry. The utility moratorium is ending April 15th. That means that We Energies and other vendors can start to disconnect. So we really want everybody to schedule their appointment so they can get energy assistance, which is a one-time benefit to their utility bill before that happens. Our heating season closes May 15th. So after May 15th, if they're not scheduled, we won't be able to give them that regular benefit. So as long as they get scheduled before May 15th, they'll be eligible for it if they meet the income guidelines. Thank you.
Thank you so much. And Cleopatra did post that information in the chat box. So please feel free to share with others who may be able to benefit from that service. And then there's also a post about the community cafe. Can you mention that briefly?
Yes, so thank you, Samaya. This is Marietta. The Community Cafe is celebration of the Week of the Young Child, which starts next week. The Community Cafe will focus on Black families' perspective on navigating an autism diagnosis and services. So the actual authors of the book will be there. And the book is entitled The Resilience, Persistence, and Resilience of Black Families Raising Children with Autism. So the actual authors will be there on April 13th, 2021 from 6 o'clock to 7:30 p.m. I did put a flyer in the chat, and I'm hoping that the community will come. And community cafes are an opportunity for parents, guardians, caregivers, families to come and learn about programs within Disability Services Division, our children's programs. That takes place on the first Fridays, and then we also have Wednesdays. And so if you sign up, you will get the information that's coming out for each community cafe. We want the community to always participate. We want to hear the voice of the community. Let us know what you think and what's going on, what we can do, how we can fill those gaps in services. What can we do? Because we're here for you. And thank you, Samaya.
Sure, thank you for sharing that information. And so what I'd like to do now, we're going to shift gears because we want to hear from the many community members who are with us. So really quick ground rules. The leaders of DHHS are committed to being transparent and responding to your questions. And as you can see, the questions that we've received already in the chat box, we have made an attempt to answer those questions. And so if there's other questions that you may have, please feel free to continue to post those, but of course, using respectful language and that sort of thing. And so I'm not sure if there's additional questions that were in the chat box or posted to YouTube that we may have missed. Okay, so it doesn't look like there's any more questions. Okay, so then what we'll do is we can move. So one of the things that I do want to point out to everyone is that there is an opportunity to provide additional feedback after tonight. So as you're thinking, if there's more needs, if there's more services, if you have more questions about other things that are available to community members, feel free to submit them at this website. And you just access this website by going to the Milwaukee County milwaukeecounty.gov, and then you're able to click on the About Strategic Plan, and that was just posted for you in the chat as well. And so if we can move to the next slide. And so what we'll be doing here is going over some questions. So we'd like to hear from you regarding these questions. And so the first, what do you see as some of the ongoing needs of yours, your families, and communities? And please feel free to use the chat. What are some of the ongoing needs of yours, your families, and communities? The second one is, what about emerging or increased needs? So some of the administrators talked a little bit about some of the increased needs or the emerging needs that we've experienced in response to COVID. But there may be some other things that you've been seeing as well. Emerging needs or increased needs. The third question here is, when you're challenged in getting needs met, what would help? And that could be you personally or people that you're connected to. And then the last question here is, who or what seems to be helping most? And so the first question again is, what do you see as some of the ongoing needs of yours, your families, and communities? I'm not sure if we're getting any feedback here from the chat.
There is currently nothing in the chat.
So we'll hold just for a second to give people a moment to think about the question. So we're starting to see some things here. One comment we received is that affordable housing options with more second chance landlord programs would be helpful. So that may be related to eviction and making sure that people can continue to have services. That's something that would be helpful. Are there any other things that may be ongoing needs or emerging needs? This discussion is really important because as we are developing the strategic plan with strategic priorities for DHHS and also the budget, our goal is to make sure that we're being responsive to the needs that people in the community have. As you heard from many of the administrators this evening who were able to speak with us, they talked about the many efforts that we're making to engage community members authentically and be responsive to what we're hearing. And that responsiveness includes investment and decision-making around policies and practices. So the feedback that you're able to share with us will be utilized to help us in continuing to be responsive. So please feel free to share. And again, if you're still thinking about it, you can use the link that was provided as well. Well, we did see earlier that there were some other questions that people had related to, let me see here, I wrote them down. The senior centers reopening was one question that we received. Another one was how we're able to support and reach out to people who are homeless. And then a third was related to the partnerships that we have to support individuals who are deaf or hard of hearing. And so I believe administrators shared that information in the chat box. So I would say a common theme is working with specific populations. Another one that we just received is, it says, many older adults don't have access to technology or know how to use it. It's one of the solutions that's provided here is to find other ways to reach them. And so I'm gonna throw that over to John and also Steve Gordetsky, who's on the line. Would you both be willing to share some of the ways that we've been trying to support older adults and having access to technology?
Sure, Samaya, thank you. And thank you, Tom, for the question. So as I said before, the challenge with the pandemic is we had to transition the senior centers from indoor social programming to virtual programming. And obviously that requires technology and technological access, which we know many of our seniors don't have. We know many of the seniors that were connected through the 5 county-owned senior center network didn't have either a laptop or a computer or reliable internet connection. In many cases, not even a cell phone or a smartphone. So we totally understand that that is an important need out there. And the pandemic just highlighted that fact for us over and over again. We have done some things with our vendor at the 5 county-owned centers to bridge that gap. Right now, our vendor is actually supporting for lack of a better description, an iPad training program. They're working with local libraries to secure hotspots for seniors, and they are purchasing those iPads, or renting those iPads, I should say, for a short period of time that seniors can loan the devices out from the senior centers to learn how to use them. The staff at the senior centers are training those seniors on how to use an iPad. And as I said, the connection is provided by the library. So it's kind of an interesting partnership. We're supporting that with some funding from the Division on Aging. We'd like to support more of that this year, if funding allows. So that's one interesting way that at least at the 5 county centers, the technological divide has been bridged. But I think just in general, it's a huge issue, and you get into issues about, well, if we purchase, or even is it government's role to purchase computers or laptops or provide internet connections? That's an interesting debate, because then you have to decide who is going to support those devices once somebody has them. Is that the government's role to actually support the maintenance and the technological issues that come up with devices once somebody has them in their home? The county's resources are pretty limited in that regard in terms of IT support. So, it raises a lot of questions too, but I can say that between all the phone calls that we've made, we've definitely done everything that we can to connect to people who don't have a device or a reliable connection, to make sure that their needs are getting met. And we also are putting some money into this training program at the 5 county-owned centers, and we'd like to do a little bit more. Hopefully with this federal funding that we're about to get, we'll be able to support that to a greater extent. And I think that's probably the best that we can do.
Thank you so much for sharing that. And that's so important that we've not only elevated that across DHHS, but that's also something that Milwaukee County as a whole and the county executive is even looking to address. So we are very well aware that individuals with disabilities, older adults, and those with limited access to broadband require additional support to get connected to technology. One question, so we have our Director of Strategic Initiatives, Steve Gordetsky, who's been working not only to advance our strategic plan, but also to respond to some of the needs that we've seen in terms of COVID-19. Would you be able to share with us just briefly some of the work that we've done in terms of COVID testing and vaccination, and how people involved with DHHS programs have been supported with that?
Thanks, Administrator Clark. And again, really great questions throughout the session, and really want to acknowledge the question around technology. That question around technology has been important and really highlighted by a response in COVID, both with our youths and older adults as well. I think, in one small way, we've looked to acknowledge some of these disparities in technology has been even with signing up for vaccine, over the last 6 months, as different organizations have brought online their vaccine programs. Initially, they would set them up as signing up for vaccine in online portals, and recognizing that older individuals and other individuals might not have access to that. We've strongly advocated for an ability to have a phone number to call to set up those appointments. Over last year, a number of us from Department of Health and Human Services and the county as a whole have worked together with public health departments and healthcare systems and others as part of Collective Impact COVID response. And over the past year, we've participated in coordinating that response across all those different elements. And certainly over the summer, a lot of efforts have taken place in rolling out testing as part of healthcare, as part of community-based sites that started out on the north side and the south side, and then ended up at Miller Park as well. And then, of course, starting at the end of the last calendar year, vaccine rollout has been incredibly important. Coordination around vaccine rollout has been incredibly important, both across public health department, healthcare, pharmacy, and others. The county has stood up several vaccination locations, including on the south side, the Kazi Center, with the work with our partners in the Office of Emergency Management. And we have partnered with a number of different organizations to specifically reach out to vulnerable residents that we serve as part of the Department of Health and Human Services. And perhaps Interim Administrator Janowski can speak a little bit about how we've partnered on connecting those vulnerable residents with vaccination.
Thanks. So we won't necessarily have time to talk about the vaccinations because we're almost at time. Thank you so much, Director or Interim Director Janowski, for posting information though about that in the chat. It talks about how individuals can get can call a number and how they can get the vaccinations at the Kazi Center. What I would like to do though, as we close out, is have Director LaGrant share with us a final comment. And then also there's a question here. How do those find out about what's available and access it? And is there a central information line or system? So Director LaGrant McLean, if you're able to talk about like how people, so we have like call centers and lines, and if you can give us a final comment as we close out this evening. Thank you.
Thank you, Administrator Clark, for that. Our website, our DHHS website will have the contact information for our resource centers. We are working on having more of a centralized area for the children and adult areas. I would say one of our great partners would be 211, because 211 can get you connected to all of the services and the resources that are across Department of Health and Human Services, and also with our partners in the community, because remember, together we can create healthy communities and we can't do it alone. So I would say that would be the best way to get in contact with us. And again, I just want to thank you all for your input, and I ask that if you have additional questions or feedbacks or thoughts about how we can better serve the community, to please reach out to us, because we want to hear from you. We want you to have a seat at the table. So thank you so much for joining us tonight, and have a great rest of the evening.